Hi, I'm Dr. Jeff Hall, international speaker and myth-busting orthodontist. In this video, I want to discuss the typical patient flow and sequence for a child who requires orthodontic braces. The key steps for a child who's having braces in your practice. Well, obviously we need to do an initial examination where we evaluate the patient facially and dentally and decide what is required with regard to their treatment. We then obtain a full set of orthodontic records, which involves radiographs, photographs, and impressions. We then evaluate all of that information and we bring the patient and the parents back for a consultation procedure where we can discuss in detail what's required, what braces are going to be placed, how long is it going to take, all of the questions that they need answered. Once they're ready to start, we then go ahead and place the braces. And usually this is about an hour and a half appointment, and it can be done either with what we call direct bonding, where we place each bracket individually, or it could be done with a much more efficient system using digital indirect bonding. But whatever it be, the braces are all placed, the arch wires are all placed that visit. Then we go into the adjustment visits. So basically in the early stages of treatment, every 8 to 12 weeks, whilst the teeth are just aligning, we see them just to look at the wires, make sure the wires are totally flat before we go to the next wire. So usually we have about 12 months of this leveling and aligning phase. Once we get into a phase of space closure or more detailing, we may need to see them more often, maybe every 6 weeks. And what we normally do to obtain high quality orthodontic finishes, we have an appointment which is usually around the 15-month mark to rebond any brackets that we need to perform the fine tuning to get the alignment and the occlusion absolutely perfect. Then when we're all finished, which is hopefully somewhere between the 18-month to 24-month mark for the average child, we remove the orthodontic appliances and then we place retainers. And we usually suggest always a lower bonded retainer to maintain the stability of the lower anterior segment. And if we can, we'll place an upper bonded retainer, but that's not always possible due to the occlusion. But otherwise, we'll definitely place a removable clear Essex retainer. If you want to know more about orthodontics, visit orthoed.com.au, the most in-depth and trusted orthodontic course in Australia.